Okay, so I'm going to go ahead and get started. Good afternoon, everyone, and thank you for attending the webinar this afternoon. My name is Dr. Aminah Keats, and I'm a board-certified naturopathic doctor, and I also specialize in integrative oncology care. And I've been with Capital Integrative Health for about 4.5 years. And at Capital, I specialize in integrative oncology care, working with patients who have a current diagnosis of cancer or a history of cancer, focusing on reducing side effects that they may be experiencing, also working to improve survival rates and also helping to reduce recurrent risk as it relates to cancer. At Capital, I also maintain a general medicine practice. So today's topic is herbal aids for stress management. And in the midst of COVID-19, we're all experiencing some level of stress as a result of the virus and everything resulting from the virus. So I'm going to share with you some herbs that we can use to help to reduce stress and the side effects related to stress. Before we get started, I wanted to share a poll with you. I'd like to ask a question to the group before we get into the content of today's presentation. So let's see, this is the first time I'm doing this. Let's see. So the first question I have for everyone is, how would you rate your stress level? So if you could, I'm going to send that now. If you could enter your answer and send that back, that would be helpful. Okay, great, thank you. Okay, so it looks like most of us have higher levels of stress, between 4 and 7, 75% of us. Okay, so that means that you are in the right place. So why don't we go ahead and get started. Okay, so in terms of the formal definition of stress, the National Institute of Health defines stress as a physical or emotional reaction that we experience as we encounter changes in life. And there are two broad categories when it comes to stress. We have physiological causes of stress, which are basically physical causes of stress, and then we have our psychological stressors. Now, when it comes to the physiological stressors, that can include things like chronic diseases or chronic illnesses or even acute conditions. It can also include things like pain or undergoing some kind of injury. When it comes to the psychological stresses, that's more of those kind of pensive or worrisome thoughts that we have around things like the health of ourselves or the health of our loved ones, things related to finances, demands from our jobs or our families or our friends or our children, when it comes to having to make big decisions and when we're suffering from loss. So why should we be concerned about stress? What's the big deal? So let's talk about that. First of all, when stress levels are elevated, we feel pretty awful. And stress can present itself in different ways depending on the individual. So some of us may experience things like insomnia or sleep disturbance, where we may be having more trouble with falling asleep or even staying asleep, or perhaps the quality of our sleep is not as good as it was before. Stress can have an impact on our emotions. Some of us may experience anxiety or depression or irritability. Some of us may experience headaches. And stress can also have an impact on the gastrointestinal tract, where you may not have as much of an appetite, or you may be eating more because of stress, or you may be experiencing abdominal pain. And stress could also lead to things like fatigue or exhaustion. Now, fatigue or exhaustion can be caused by insomnia, because obviously if we're not getting enough sleep, we're going to be feeling fatigued. But it can also be just a result of the chronic stress kind of picture, because there are a lot of things that go on behind the curtains from a cellular level when it comes to elevated stress levels. So it may just be a result of the stress itself. Now, studies have shown that when we have chronic levels of stress, it does have an impact, a negative impact in our immune system. So definitely something that we need to address and pay attention to. Also, 75 to 90% of human diseases are related to the activation of the stress system. So common chronic conditions that we're familiar with, like cardiovascular disease, like high blood pressure, or metabolic conditions like diabetes, or neurodegenerative diseases like Parkinson's or Alzheimer's, and then cancer. So not to say that elevated stress levels are a direct cause of these chronic diseases, but stress certainly does contribute to these kind of conditions. But the good news is that there's a lot that we can do about it in terms of reducing stress levels. So the two categories of herbs that I'm going to be speaking about today are adaptogens and nervines. Now, these herbs help us to cope with a wide range of stressors. And I picked this picture because I envisioned this blue superhero as the adaptogen and the nervines just knocking stress right out with that big pow. So when it comes to adaptogens, adaptogens are a popular category of herbs that have been used for stress management for centuries. And they help to support our body's ability to accommodate these physiological stressors and these psychological stressors. Now, there are a lot of adaptogenic herbs, but the general mechanism of action that they typically all share is that they work at a molecular level by regulating a balance or hormonal balance between the hypothalamus, which is located in the brain, the pituitary gland, which is also located in the brain, and the adrenal glands, which are glands that sit on top of our kidneys. So there's a certain hormonal communication that occurs between these parts of our bodies, referred to as the HPA axis. And the adaptogens help to kind of balance this communication so that we're not in a state of chronic stress. Specifically, you may have heard of cortisol as it relates to elevated stress levels, and adaptogenic herbs, especially the two that we're going to be discussing this afternoon, have been shown to lower chronic levels of cortisol. Cortisol, when it is acutely elevated, it's fine and it's normal. So for example, if we come into contact in a dangerous situation, so suppose you're crossing the street and you see a car quickly approaching and you feel like you may be in danger, your cortisol levels will rise. When you're away from that dangerous situation, your cortisol levels will drop. That's completely normal and fine and not harmful. However, when cortisol levels remain chronically elevated, so for example, elevated over weeks, days, months, years, that's when it becomes problematic, because it can lead to things like high blood pressure or dysregulation of blood sugar, weight gain, etc. But the good news is that adaptogens can certainly help with modulating cortisol levels. Now, the first adaptogen that I'm going to speak with you about is ashwagandha, and ashwagandha is really a superhero within this family. It's the most commonly used adaptogenic herb and certainly the most extensively studied adaptogenic herb. And an interesting fact that I learned about ashwagandha recently is that the meaning of ashwagandha means the smell of a horse, which certainly doesn't sound appealing, but also the kind of long-term history and use and thoughts around ashwagandha is that when you take it, it gives you kind of the stamina and the strength of a horse. So perhaps that aspect is a little more appealing. So ashwagandha is grown in South Asia, Central Asia, and also in Africa. And outside of acting as an adaptogen, it has many other properties. It is a natural inflammatory herb. It also acts as an antioxidant, which means that it helps to protect our cells from any kind of damage, DNA damage specifically. It's an anxiolytic, which means that it helps to reduce anxiety. And there are some cell studies and animal studies suggesting that it may help to inhibit the growth of certain cancer cell lines. Now, as I mentioned, this is one of the adaptogenic herbs that is more extensively studied. And I just wanted to highlight this study for you. This was a prospective, randomized, double-blind, placebo-controlled study, which is pretty much the gold standard when it comes to a design of a study. And so the goal was to evaluate the efficacy of ashwagandha, or how effective it was in reducing stress and anxiety and improving the general well-being of adults who were under stress. So you had one group who received a placebo, meaning just a fake pill, and then you had another group who took a standardized extract of ashwagandha at 300 milligrams a day, and this happened over a 60-day period. And what the researchers found was that the group who received or took the ashwagandha, they showed improvement in resistance towards stress, which basically means that their cortisol levels were lower compared to the control group, or the placebo group. And they also found that there was reduced reporting of anxiety and insomnia, and there was less fatigue reported as well. Now, the second adaptogenic herb that I'd like to review with you is called Rhodiola. This is another popular one. Now, Rhodiola is native to Canada, Scandinavia, and Siberia. And outside of being an adaptogenic herb, it also acts as an antidepressant. So this is something that stands out for Rhodiola compared to ashwagandha. Ashwagandha is not so much of an antidepressant compared to Rhodiola. It also acts as an antioxidant, antiviral. It's been shown to inhibit the replication of certain viruses. It also acts to support the immune system. So it may act on T lymphocytes in the immune system. This also is an anxiolytic. It may help to protect cardiac cells or heart cells. And it can also be neuroprotective, so in terms of supporting cognitive function. Now, there are many studies regarding Rhodiola as well, and that's actually why I chose this herb to review this afternoon. So studies have shown that Rhodiola can help to improve physical performance. It's actually been studied with athletes over time, and it's been shown to help to improve endurance. It can help to improve energy levels, mental fatigue, or this feeling of feeling mentally drained or not as cognitively strong as you should be. It also helps to improve or reduce depression. And similar to ashwagandha, Rhodiola can also help to reduce cortisol levels. So in one study, this stood out to me: stress resilience and improved energy levels were seen just after 3 days of taking Rhodiola. So I wanted to point this out because sometimes when we're prescribed medications or when natural supplements are recommended, sometimes we have to take them over time before we receive a benefit from it. But in this study, it showed that the patients actually noticed improvement pretty quickly. So I'm going to take a pause. I'm not sure if I have a question here. Oh, okay. Alrighty. So how do we determine, you may be wondering at this point, how do I determine if I should take ashwagandha or Rhodiola, which is most suitable since they're in the same family? And so when it comes to ashwagandha and Rhodiola, they both help to improve energy levels. They're both going to help with managing elevated cortisol levels. However, ashwagandha is more specific to stress and anxiety together. and also insomnia in that picture. So if there's a high stress level, if fatigue is a concern, if anxiety is a concern, and if insomnia is in the picture as well, that would be more of an ashwagandha kind of picture. However, with rhodiola, what stands out more so is more depression versus anxiety, and also that mental fatigue or that mental kind of drainage where you're feeling like you're not functioning cognitively as you wish to, or if you're feeling like you're not as productive as you typically are just because you're not able to think clearly. That would be more of a rhodiola picture. Now, as far as delivery forms, there are many options when it comes to herbs in general in terms of how we can take them. So they are available in tea form. So you can take either of these herbs in tea form. You can use the powders and mix the powders in hot water and make a tea out of that, or mix them in a smoothie perhaps. There are liquid extracts available, and there are also capsules available for both of these herbs. Now, a tip is that when you're purchasing herbal supplements in general, especially these two, you definitely want to use a standardized extract. That's really the gold standard. And a standardized extract means that there's a guaranteed amount of the important constituents from that plant, guaranteed from capsule to capsule. If it's not a standardized extract, it may not be effective because you may not be getting the amount of that particular constituent in that plant that you should be. Now, I also want to note here that we do have to be cautious with drug and herb interaction. And so if you are thinking that either of these herbs may be beneficial for you or something that you're curious about, it's definitely important to talk with your healthcare provider about that before introducing. In general, the tea forms are okay to take even if you are taking a medication. The capsules are more of a concern, but in general, it's definitely something that you should be discussing with your provider. Okay, so before I move from the adaptogenic herbs, does anyone have any questions? I'm just going to check up here. I don't think so. Okay, so I'll move right along here. Okay, oh, I think there is a question. Okay, so the question is, are these taken as needed or daily? I would say for the adaptogenic herbs, when we're managing stress, definitely daily. You must take it consistently in order to receive the best benefit from it. Okay, now the next family of herbs that I'm going to review are the nervines. And the nervines are herbs that help to support the nervous system. Specifically, they help to reduce things like muscle tension. If you're feeling very tense, it helps to reduce insomnia, can also help to reduce anxiety and depression, and then circular thoughts or a busy mind, and then worrisome thoughts as well. Okay, so the first nervine that I'm going to be reviewing is a lemon balm, and I actually have a box of it here that I'll show you. I bought this from Mom's yesterday. Okay, so lemon balm. So uses of lemon balm, great for anxiety, great for insomnia, can also be used with depression or ADHD, these hyperactive kind of conditions, because it's very relaxing, can also help with cognitive function. And lemon balm is also a good antiviral. It's been studied with herpes simplex specifically in terms of helping to reduce the duration of that particular virus. So nice benefits with that one. It also helps to support digestive function. So for those of us who may be experiencing anxiety that comes with some gastrointestinal kind of side effects that accompany the stress or the anxiety, this may be something to consider. The proposed mechanism of action as it relates to addressing anxiety and insomnia is that lemon balm probably increases GABA levels. GABA is a neurotransmitter in our brains, and so that's probably how it works. It's not completely determined, but research studies do suggest that. So in terms of studies that are out there regarding lemon balm, under acutely stressful circumstances, lemon balm has been shown to improve cognitive performance and mood and reduce stress. And it also has been shown to help to reduce anxiety. Now, when lemon balm is paired with another herb called valerian, it's been shown to help with insomnia even more so. So pairing lemon balm with valerian does have a synergistic effect when it comes to helping to balance our sleep cycles. In terms of forms of delivery, I really do prefer the tea when it comes to the nervines, just because the tea can be very effective and can be taken as needed. So you can either purchase the tea bags or you can purchase the dried herb. If you do purchase a dried herb, the general kind of recipe for that is 1 teaspoon of the herb to 1 cup of water. An interesting recipe, if you're more interested in iced tea versus hot tea, is that you can add peppermint leaves to the lemon balm and chamomile flowers, strain that for about 10 minutes and have it cool instead of hot. The chamomile is also very calming. That's another nervine, so that would add an additional kind of calming effect. Other forms of delivery for lemon balm would be a liquid extract and a capsule form as well, but I definitely prefer to recommend the tea form of it. Now, passion flower, this is a really pretty one. That flower is beautiful. The passion flower is another nervine. Now, this is native to southeastern United States and Central and South America. Passion flower can be used to address insomnia and anxiety and ADHD, similar to the lemon balm. Now, when it comes to these two herbs, you can really use either of those or combine them for a greater effect when it comes to addressing anxiety and insomnia. There are studies with passion flower as well. And this study that I've highlighted for you, this is a double-blind randomized trial as well, again, which is a kind of a gold standard model when it comes to creating studies. But the passion flower was compared to a medication called Serax. Serax is prescribed for general kind of anxiety conditions. And they found that the results from the study was that the patients who took the passion flower and the patients who took the Serax, the medication, the benefit was pretty much equal in terms of helping to control anxiety. So very effective. In terms of forms of delivery, just like the lemon balm, you can take it in tea form, you can take it in liquid extract form, and you can take it in capsule form as well. So I know that was a kind of a quick review of the herbs there. I'm happy to take any questions, and I just want to conclude by saying the greatest wealth is our health, and start with the mind first, because we know when our mind and stress levels are off balance, that certainly has a greater impact on our physical body. So I think that I have a question up here. I'm going to go ahead and select that. Okay, so the question is, if I start taking adaptogens daily, for how long should I take them? So for adaptogens, I would say that they, in general, of course, it depends on the patient and the presentation, but in general, I would say that they should be taken for at least 30 days before you start to receive benefit. Now, we did see the study where the participants did receive a positive result or experience a positive result after 3 days. But I would say at least 30 days. It depends if the stress levels are kind of extended. I've had patients stay on adaptogenic herbs for 30, 60, 90 days. It just kind of depends. But in general, I wouldn't keep a patient on an adaptogenic herb past 90 days. Okay, next, sure, you're welcome. The next question is, once we have cleared this with our doctor, where are the best sources to find these items? Okay, that's the one part of the question, so I'll answer that first. So the best place, so you have to be very cautious and mindful about where you purchase supplements from. So if you are seeing a integrative health provider like a functional medicine doctor or a naturopathic doctor, they should be able to order a high quality supplement for you. If that is not the case, then I would recommend an apothecary, something like Village Green, if you're familiar with that, in Bethesda, or an apothecary in general, where they do order professional grade supplements. The second part of that question, and to clarify, nervines are as needed, and that is true. So adaptogenic herbs are more daily, longer term. The nervines are absolutely as needed, and you can certainly rotate nervines as well. Okay, any other questions? So the last thing that I wanted to mention is that, I can just get to the last slide here. So at my website, drkeats.com, I'm going to be posting within the next week, I'm going to be posting some additional stress relieving kind of natural tips and recommendations. So feel free to visit my blog page at drkeats.com. Thank you. Thank you. Okay. Well, if there aren't any other questions, oh. Okay, wait. I think there is another question. Okay. So that's just a thank you. Okay, thank you. Okay, thank you everyone for attending. I hope these tips were helpful. Enjoy the rest of your day and your weekend, and stay tuned for additional webinars. Okay, bye everyone.